Professor Sharma here. In this lecture series, I will be discussing about different aspect of radiation treatment with the lens of the radiobiology. Okay, so we will be exploring the things how radiation and why radiation is being used to treat the cancer. But we will be focusing on the radiobiological context there. Okay. So basically, we'll dive into what is cancer, okay, how radiation works at the cellular level, and what makes it such a powerful tool in fighting tumors, in fighting cancer. Okay, so let me zoom in here. Let me display this how the healthy cell turn into the cancer cell. You can see this visualization. You can see this animation. You can say that how healthy cell turn into the cancer cell here. Okay. Okay. Now let's begin the radiobiological basis of cancer treatment. First of all, what is cancer? Okay, that is the very important question. What is cancer? So one key thing in all of the cancers are cancer begins with the normal cells. But when the normal cells lose its control to its growth, and why it lose the control? Because something changed in DNA, whether the mutation is DNA, change in DNA, or the damage in DNA that causes the normal cell turn into the cancer cell. Okay, so this damage can be caused by many things. Okay, the damage can be caused by chemicals, or maybe the viruses, or maybe the radiation. Okay, any kind of radiation which is energetically suitable to damage or to alter the structure of DNA. Okay, so basically when the cell fails to repair itself, okay, it keeps dividing and dividing and dividing. Finally it forms the tumor, and that tumor started to grow and grow, that we call the cancer. So this is the solid kind of cancer tumor we are talking about. But there are the cancer which do not form the solid form. For example, blood cancers. So in blood cancer, you cannot see any kind of the lymph, any kind of the tumor, but only you have not that kind of thing, but the characteristics is the same. DNA damage, DNA mutate, something changes in the basis, the fundamental basis of the cell, that is DNA. So let me show you some visual here. So how the DNA strand being hit by the free radicals or by the radiations, okay, how it can be damaged and then it can multiply, how tumor forms. So let's see this visualization here. So we are focusing here the radiation effect on tumor. That's why I am not going into other topic. But when we use the radiation affects our DNA, whether normal cell DNA or the tumor cell DNA or cancer cell DNA, in direct way or indirect way. So in direct way, it breaks the double strand in the DNA. If the double strand of the DNA is broken, then it would not repair. Then it will die. That means it will stop the growth of that cell, whether it is normal cell or the cancer cell. We wanted to kill the cancer cell. That means we want to kill the DNA of that cancer cell. Okay, but there is an indirect way to damage the DNA by using the radiations. So that is the formation of the free radicals. Okay, so the free radicals are the unstable molecules. Okay, so often generated inside our cell. Okay, radiation can generate the free radicals. Not only the radiation, what we eat also create the free radical. That's why I always tell people don't drink, because they have the ability to create the free radicals in our cell, and these free radicals continuously harming the DNA, and finally it changes the DNA, it alters the DNA, it damages the DNA, and that DNA then begin to grow as a tumor. Okay, so radiation can generate also the free radicals, especially from water molecules, because all of our cell must have the water, and these radicals attack DNA and breaking it and disrupting the cell's control system. Okay, here is the visualization. You can see here the how X-ray or the radiation hitting the water, they form the hydroxyl radical, and that hydroxyl attacks the DNA, and that alters the DNA and forms the tumor. Now, so radiation therapy uses the high energy rays to kill the cancer cell. Okay, it works two ways, direct way and indirect way. So by the way, the radiations, it may be in the form of the electron, you can give the electron therapy, or you can use the X-ray, which is the photon. Most of thing we use the photons to kill the cancer, or some instances we use the proton, we call the proton therapy. So either it is the direct effect or the indirect effect, both lead to a point where the cell can no longer divide and eventually dies, a process called the mitotic death. Okay, so what is the real goal for the radiation, using the radiation to kill the cancer? Okay, so what is the main goal? What is the main goal? Can you tell me what is the main goal? Main goal? What is the main goal to use the radiation to treat the cancer? So the main goal is to maximize the damage to the cancer cell while minimizing the harm to the healthy tissue. So when we use the radiation, it not only kills the DNA of the cancer cell, it also kills the DNA of healthy cell. So how to balance that? We need to minimize to harm the healthy cell, normal cell, but we have to maximize the damage in the cancer cell. Okay, we know that the cancer cell divides quickly because it bypasses the system in which in our body, in our cell, there is a signaling process, and that signaling process tells us when cell need to divide, when cell start to grow, mature, and when cell need to die. But the tumor or the cancer bypass that mechanism. It grow unchecked, are less efficient repairing damage. So they are more vulnerable to radiation. When we use the radiation to treat the cancer, your radiation oncologist and his team or her team or their team basically takes the 4R in their consideration, that we call the 4R in the radiobiology. 4Rs. The first one is the repair. So you hit the cell, cancer cell, with the radiation, okay, and it damages or it affect, it alter the DNA. It affects the normal as well as the cancer cell DNA, but the normal cell DNA repair. If anything effect happen, normal cell has a tendency to repair, so that it comes to the original form. But the cancer cell has the less ability to repair. Okay, that is the reason we use the fractionation in the radiations. Okay, so if you go in the radiation therapy unit, for example, somebody has head and neck cancer, it needs 70 gray of the radiation, maybe the X-ray radiation, to shrink the tumor. So you cannot give the 70 gray at one time. If you give 70 gray, there is the toxicity created by the radiation, the person will die immediately if you give the 70 gray radiation at one time. Okay, what you do, you divide that 70 gray, maybe the 2 gray each day, 5 days a week in United States. You can say that. You can say 5 multiplied by 2, that is 10 gray per week. Maybe the 7-week course, if you need the 70 gray, during the 7 weeks, you complete the 70 gray delivery course of the radiations. So if you fractionate in the 2 gray each day, this 70 gray, it helps to repair the healthy DNA, healthy cell DNA, but at the same time, each day you are hitting that radiations, that tumor, and that tumor DNA cannot repair. So first of all, the repair is the first thing a radiation oncologist think about when use the radiation. Okay, normal cell can repair the damage, cancer cell often can't. That is the basis for the fractionations of the radiation dose. The second principle of the radiobiology to treat the cancer using the radiation is the reoxygenation. Reoxygenation. Okay, so the oxygen makes the radiation more effective. Okay, tumor often reoxygenated between the doses. Reoxygenation makes the radiation more effective. That is another basis for the fractionation of the radiation doses also, not only for the repair, but reoxygenation process takes place. If the cancer cell has a very little amount of oxygen, and they will not be effective, the cancer treatment using the radiation treatment, radiation therapy would not be effective. So you need to have reoxygenate these tumor cells. If they are reoxygenated, if there are oxygen molecule there, then the radiation interact with the oxygen, that will effectively kill the DNA. So the reoxygenation is the another principle we consider to treat the cancer using the radiation therapy. Okay, you see here the effect of the oxygen here, that is the oxygenation effect in the radiation therapy. That is the big topics. I will come to that point since this is the first lecture. Third principle is the redistribution. I can tell you here the third principle of the radiobiology when you use the radiation to treat the cancer is the redistribution. Okay, so cell move through the different cell cycle. We have the 4 different cell cycle. Initially the gap 1, okay, then the synthesis phase, then gap 2 phase, and then the mitosis phase. So these are the phases. I'll come to that point, these 4 different important cell cycle, and depending upon these cell cycles, some cycles are really sensitive with the radiations. So we try to hit the DNA at the same the cell cycle in which the radiation sensitivity is very high. Okay, so some phases are more sensitive to radiation, so we wanted to know about these phases so that we can hit and kill the cancer. So redistribution is the another principle we use when we treat the cancer using the radiation. And the final principle is the repopulation. So you hit the cancer cell by using the radiation, the normal cell or even the cancer cell try to repair. Normal cell repair very well because the mechanism is there to repair. But cancer cell has not that kind of mechanism, but still they try to populate. Okay, they again they try to repair and repopulate, regrow, but at the same time, due to the fractionation, we again heat the radiation in another day. Okay, so both the healthy and the cancer cell try to regrow, but the fractionated doses help us outpace the tumor regrowth. Okay, that's the fourth principle we're gonna consider when we treat the cancer using the radiation therapy. Radiation is given in the multiple smaller doses, which we call the fraction. Okay, over several days or weeks, because the fractionation allows the healthy tissue to repair, and also it encourages the tumor to reoxygenate it. Once it reoxygenated, when you hit by the radiation, so it will be highly radiosensitive and the DNA of the cancer cell will damage. That's how you shrink the tumor, and it takes the advantage of the redistribution. So that's why I explain you here. But the radiation, the fractionation of the radiation also can be related with the acute versus late effect of the radiation. Radiation, when you use the radiation has immediate effect, and radiation has the long-term effect. Okay, I told you that if you expose to the radiation right now, the effect can be seen after 30 years. That is the late effect. Effect can be seen in the 10 years. So when we use the radiation not only affect the tumor, it also affect the healthy cell. So these effects we divide into the acute effect and the late effect. So in acute effect, we can see that skin redness. You apply the radiation, use the radiation, the skin dose, skin tone becomes red. Okay, skin redness. You feel fatigue. You may be irritated. Okay, these are the acute effect. But there are the late effect. For example, fibrosis. Okay, maybe the organ damage, maybe even secondary cancer. You treat the cancer right now, but after 7 days, 7 years or 10 years, I don't know, depending on the amount of the exposure or the nature of the cell, it is affected. So second cancer can reemerge. These are the late effects. So your radiation oncologist or your oncologist will take all of this in their consideration while they use the radiation.